Inserting a Ryles tube in an agitated patient on NIV support is a delicate process, but it's essential for their care. Let's walk through it step by step. First, we carefully remove the NIV mask, but make sure you're closely monitoring the patient's vitals throughout the procedure. Now, the next step is lubricating the Ryles tube. You want to do this generously. The more lubricated the tube, the smoother the insertion, and the less discomfort the patient will feel. Remember, the patient is already agitated, so anything we can do to minimize additional stress is crucial. When you're ready, start by gently inserting the tube into the nostril. Aim towards the ear on the same side of the nostril to follow the natural curve of the nasal passage. This part can be tricky with an agitated patient. They might gag or try to move away. If they gag, pause for a moment, reassure them, and encourage them to take deep breaths. If the patient is conscious and able, you can offer sips of water or ask them to swallow, which helps guide the tube into the esophagus. Keep going slowly and steadily without rushing. If the patient becomes too restless, have your assistant hold their head gently, keeping them as calm as possible. The goal is to avoid causing unnecessary discomfort or nasal trauma. Once the tube is fully inserted, it's crucial to confirm that it's in the stomach and not in the lungs. You can do this in one of two ways. First, you can aspirate gastric contents using a syringe. If you get gastric fluid, you're in the right place. Alternatively, you can inject a small amount of air into the tube and listen for a whoosh sound using a stethoscope over the stomach. If you hear the sound, the tube is correctly placed.